This is Siobhan. She's a palliative care nurse, and she uses clean language to find out what her patients really want when they say the word support. They could mean a million things, but she uses clean language questions to drill down into what they mean by what they say, and that makes a profound difference. This is Saskia Dorman. She's a consultant in palliative care, and she told me the story of how she asked a dying woman, "What would you like to have happen?" That's a clean language question. And Saskia found that this particular lady wanted to get out into the sunshine, and so she was able to help. Saskia was the person who asked me to provide a taster of clean language for the palliative care network in the southwest of England. It went brilliantly, and as a result, she asked me also, myself and Steve, to provide 5 half days of clean language training. They got a waiting list of 45 people. 16 of them were able to join the training, and they got a lot from it. Of those 16, 12 have said that they are definitely using clean language in their practice ongoingly. They're excited by it. But of course, there's only ever so much money. We have not yet been able to find the cash to train the other people on the waiting list. So instead, we paid attention to how might we build a community of practice? How might we gather other people who've learned clean language within the NHS and start to scale that way? Hisham Abdullah, he learned some clean language from me and someone called Jackie Lawler about 7 years ago back in Birmingham. He's a consultant paediatrician. Nowadays, he's on the board of the Q Network, which is a quality improvement network within the funded by the Health Foundation. The idea is improving quality in the NHS. And they have a community, and they were willing to help us run an online open space for everyone we could find who was interested in clean language in healthcare. We ran that in September. It went really well. We had 80 people register. About 45 people turned up. They had lots of conversations on all sorts of different topics, including how clean language could help the NHS save money and be more efficient, provide quality care. I also did some really good interviews with Hisham, with Saskia, about what they were doing with their clean language. Hisham made a splash because he was talking about how in his clinical practice, clean language helped him to get to the heart of the matter more quickly. He said, "What matters to patients and what matters to me becomes very clear, crisp, and concise, and that actually abbreviates the consultation." And that's before he started about how clean language was highly relevant in conversations with colleagues too. As a result of those interviews, which you can find on YouTube, we've been able to have lots of useful conversations with people in different health trusts around the UK who are curious and think, I wonder what kind of clean language training my teams might be able to have. We've got a few off-the-shelf products that we can offer. Steve set the goal of, let's see if we can reach 1 million people in the NHS with clean language. Well, why not? There are more than 1.5 million people working in the NHS. We should be able to reach 1 million without any problem. But there are lots of different ways to go. Of course, we're a commercial organisation, so we need to find ways to be funded. One of the things we're doing is applying to the Q Network for funding to develop the Clean in Healthcare special interest group there. We hope we'll be able to run taster events. We'll be able to run another online open space. We're also talking to individual trusts about training that we would get paid to deliver. That includes the Better Conversations in Health and Social Care training, which is 6 one-hour sessions delivered over 6 weeks online. It was created by Simon Coles and Chandima Dutton to be the minimum effective dose of clean language that will make the difference. They've tested it extensively. We love it. We think it's really powerful. And some of you who are listening to this have already experienced it. There are also offerings such as Collaboration Dynamics, which is 6 times 90 minutes, and it's designed for team development. People get to learn clean language questions, yes, but the basic situation that they're being used in is developing the ways their team can work together in those complex and fast-changing environments. We're also talking to people in America. There were 3 people at that online open space, including Robert here, who were in America and have contacts inside the US healthcare system. Who knows where those conversations might go? And all of this came about to some extent because I'm the co-author of this book. 15 years ago, this was published, Clean Language Revealing Metaphors and Opening Minds, written by Wendy Sullivan and myself. It's still selling. It's been translated into Russian, Japanese, and German. You might have read it. And this specific project came about because an online contact, Andy Brogan, I had a virtual coffee with him, and he said in passing during that conversation, Saskia wants to talk to you. I had to chase Saskia for literally months to get a virtual coffee with her. Once we did talk, we could instantly see that this was a new adventure that both of us could get involved in. We were excited by it, and we're still working on it now together with Steve, with Hisham, and with Kath Rooksby, who was involved in that first training. We don't know where we're going next, but it's going to be fun.